Hello, welcome to Conversations with the Chamber. I'm Jim Burnett, the Executive Director of the Eden Chamber of Commerce, and this morning we have Dr. John Dabbs of Eden Chiropractic with us. John, welcome, and thank you for being here.
Thank you, Jim. What a great honor it is to be able to come and sit with you and talk a little bit about what we've tried to do in Eden Chiropractic with Eden.
Well, that's fantastic. That's exactly what we want to do today, let everyone know exactly what's going on. But first, before we get into Eden Chiropractic, let's talk about you, John. Tell us about you.
Well, I grew up here in Eden.
Your homeboy.
I'm a homeboy, yes, sir. Went to Moorhead High School and graduated from Moorhead High School in 1987. Had to ride the ARC to get there, but we made it, and what a great experience it was, all growing up through here. I was a Douglas Elementary guy, and Leesville Spray Intermediate at the time was 5th and 6th grade, and then, of course, at that time it was Holmes Junior High,
right,
and has recently become the middle school, of course, and then to Moorhead. And what a great honor it was to kind of come through there. The teaching staff and just the community was fantastic growing up, and they really rallied around all of us, and left here and went to East Carolina, had the opportunity to play a little football, and then ended up with an injury and got into cheerleading, and from there went to Life University down in Atlanta for chiropractic school, and met my wife through a cheerleading opportunity. She and I got on the United States performance team.
Oh, wow.
And traveled to Japan to perform over there for 10 days. So I sat beside her on the plane flying to Japan, and she didn't throw me off the plane, so I figured she was a keeper. So moved her back to Eden, North Carolina, and we've been here almost 30 years now. So we'll celebrate our 30th wedding anniversary in August, and I'll celebrate my 30th business anniversary in June.
Wow.
Yeah.
You're a lot older than I thought you were, John.
Well, Olive Olay keeps me looking
There
youthful.
you go.
Yes, sir.
Okay, very good.
That's how
very
that
good.
works.
Well, we want to talk about Eden Chiropractic, but two things. What is chiropractic, and what interested you in chiropractic?
Absolutely. What a great question. So what interested me in chiropractic first, Dr. Bob Vaughn, who I ended up taking the practice over from, his father-in-law, Ken Miller, started our practice in 1948. And ironically, he started over top of Jones Hardware. And those viewers who remember Eden, remember Jones Hardware. And so in 1948, he put the chiropractic shop over top of Jones Hardware. And he practiced there until 1952. Dr. Miller was one of the board presidents of the state association at the time, and his license number was number 7. He was the 7th chiropractor in the state of North Carolina, which was really kind of neat. And then his son-in-law, Bob Vaughn, came in 1975 and joined the practice. So Dr. Miller took the practice from over top of Jones Hardware and built a building on Boone Road in 1952. And we were in that building until 2023 when we transferred over and moved to where we are now, which is the old Lidl building, if you will. And we kind of partnered up with Dayspring Family Medicine to really build out what we thought the community could really utilize, because we wanted to really serve the population of not just Eden, but Rockingham County and the surrounding community, and really look for underserved populations that we could really house. So that's kind of how we got there. What got me into chiropractic was Dr. Vaughn, again, was our team doc, and I told him I ran up such a bill coming to see him through high school that I had to come work it off. But chiropractic is an art and science of medicine where we don't use a lot of medication, but we use more modalities, and we use more nutrition, exercise, biomechanical analysis, and try to really stimulate the body to take care of itself. So we're going to incorporate sleep patterns. We're going to incorporate vitamin nutrition. We're going to talk about what's the best type of food to eat. We're going to talk about smoking cessation programming, different things to make the body function at a higher level. And we're going to continue to encourage each age group, whether it be newborns all the way to geriatrics, whether it be weekend sports enthusiasts or professional athletes.
So you do it all.
We try. I tell everybody we're a little ADD, but we like to do a lot of stuff, and we like to really incorporate things that we feel like the community needs, and that we were having to travel a lot to get. So we wanted to bring that in-house.
Right. I know, and I know you have expanded and do offer a lot. I will go back to my personal experience during my running days. I was a regular at your office
Yes, sir.
to help me with my back. So I appreciate all the work you did on me at that
Absolutely,
point. So,
absolutely. I remember watching you lots of times running up and down that road on Boone Road, and I think that guy's going to be a patient one day.
yeah, exactly. So tell us a little bit more about some of the individual things that you offer. You mentioned several things, but
Yes,
more
sir.
about the sports medicine and that type of thing that you
Sure,
offer.
sure.
John.
So inside of our office, chiropractic in general uses manipulation to the spine and the joint complex. So we're not just a spinal company. We're going to look at extremities. So we do a lot of knees, ankles, hips, shoulders, elbows, hands. So we're looking at carpal tunnel syndromes. We're looking at headaches, of course, low back pain, neck pain, all those kind of things that people associate us with. But it's a lot bigger and more broad than just those opportunities. Inside our office, we're going to look at biomechanics of all of those joint structures, and not just how they move independently. We're going to look at how they move together. So most of us don't just move our head. When we're walking, we're taking our hips and our feet. All of that comes into play when we start talking about what our true functional biomechanics are. So if we just look at one part of somebody who comes in with, say, low back pain, then we're missing really what may be the causative factor. So if you came in with low back pain from running, is it really the back that's giving you a fit, or is it your heel strike off of your run? Do you have pronation off your foot? So we take all of that into account to design first a true diagnosis, a functional diagnosis instead of just a pathological diagnosis. From there, we can set up treatment patterns, whether it be using physiotherapies like ultrasounds, muscle stems, laser, traction, active release, muscle massage, all those kind of things, all to benefit the patient to get them back to a higher state of wellness faster.
Yes, I think that's to me very, very key, John, in that you are offering individualized care for each patient that you have, rather than it's a blanket thing for, you've got back pain, so we'll rub your back and take care and send you on home and let you come back next time. But now you're looking at the true root cause of this and trying to get to that point and finding out how to treat that.
Exactly. And if all we did was come in and just put a Band-Aid on it, then you go back out and you start the same activity over and over and over again.
Right.
And in our community here, a lot of what we've had traditionally has been factory work, those kind of things, so repetitive stress injuries. And if we don't fix the root of the cause and they go back and start doing the same mechanical output again, they're going to just end up in the same place that they started and what got them in our office to begin with.
Right.
So we've got to figure out better opportunities to get these people well and to keep them well. So my job is to work me out of a job.
Right. And sometimes that's a hard concept for folks to understand, but
Yes, sir.
but that is what your goal is.
Absolutely.
So now you offer a lot of different services within your building now.
Yes, sir.
So talk a little bit about those, but even before you get to those individual things that you offer, how did you determine what the community needed?
Yes, sir. So a lot of it came off of just kind of what we felt like we needed as we were kind of growing up and stayed in athletics, and then watching my parents and some of our colleagues from around us and kind of seeing what we weren't able to serve them with. And they were having to go out of our community to get these services. So when we started looking at, what's one of the first things to offer, we started looking at active release or myofascial release, and then we got into something called Graston, which is an instrument scraping to decrease scar tissue or fascial restrictions. And so a lot of folks outside in bigger cities were offering this, and it was an easy adjunct for us to bring in. And then we started looking at things like laser weight loss. What can we do to kind of expedite people's opportunity to lose weight and to start to get fit? And not that our laser weight loss is the be-all, end-all, but it's a good spark plug to get us going. Right. And usually what people need is they just need to get the ball rolling. They need to get motivated just a little bit. And if they can see a little bit of a positive result, it's so much easier to get them biggerly motivated.
Right.
So that's been a big thing, and we're really careful to say, hey, with this, it gets us started, but we also have to exercise. We have to eat right. We've got to change some habits. And that's a hard concept for a lot of folks to utilize. So we added that laser weight loss, and that's been a really a positive benefit for us. We have a full-time nutritionist on staff also who is just fantastic. She's been with us for about 18 years. Kayla Underwood is her name, and ironically, Kayla was one of my very first tumbling kids when I moved back here.
Is that right?
And we celebrated her 10th birthday together. I remember that, and so she's been with us even through high school. She was an intern with us, and when she went off to college, she came back on the summer breaks and worked with us. So it was a nice evolution to work her into our full-time positioning, and she's now our office manager, and she's been fantastic, game changer for us for sure.
Yes, she is.
Even with that, just talking about the women in my life, my wife, Debbie, who's a physical therapist, she has her company called Pro Therapy Concepts underneath the same roof as ours. So we work differently as far as two different entities, but we work underneath the same roof, and we're very complementary to each other. So we do a lot of orthokinematics. We're looking at a lot of joint structure restrictions. She's looking at a lot of biomechanics, muscular abnormalities, differentials off of that. So she's doing things like vertigo. She's doing post-surgical rehab. She's doing stroke rehab. We have a lot of amputees right now who are coming through, just learning how to be independent again. And then as an adjunct, one of the things that we found through her company is that people needed an outpatient therapist to be able to go to their house. So it's different from in-home therapy for folks who can't get out. These folks can still get out, but they have more difficulty doing that. So Debbie's company will actually go to people's houses until they're 100% comfortable leaving and being able to come to her facility. So that's been a really neat opportunity for us. And then they're doing things like women's pelvic floor. So women who have postpartum or had a baby who are having some difficulties, women-wise, we have therapy for that, which before you had to go to Greensboro or Charlotte or somewhere else to get that kind of therapy. So they've done that. And then she's also brought on STEM wave, which is an acoustic wave therapy. And what we have found is when you talk about stem cell regeneration, stem cells are the healing mechanism that comes out of our bone system to allow tissue to heal faster. And what we found with this acoustic wave therapy is that you can cause, I hate to say micro trauma to the bone, but it tricks the body into thinking that they're having trauma in that area again. So it releases natural stem cells as opposed to us having to use a needle biopsy and pull that out, centrifuge it down, and reproduce it. And we've had tremendous results with that.
Wow. That's very, very innovative. How new is that type of therapy, John?
Acoustic wave therapy has been around, for 10 or 15 years, but it's really hit the market in our type of businesses for about 5 years. Okay. And we're just really seeing a resurgence on it, or hard surgence on it over these last 5 years, because people are really starting to understand it more and more and more, and really figuring out what the capabilities of it are. When we brought it into our place, it was a game changer. I mean, we've had folks who were scheduled for knee surgeries, hip surgeries, shoulder surgeries, be able to postpone those, if not put away those completely. Wow. Things that we just couldn't get to heal up, they're doing great. Yeah. Even Debbie, who she was a college gymnast and broke her back in gymnastics, has had a lot of just back problems over and over and over. And this has really patterned her to where she could get back to her normal training and normal lifestyle and be able to sleep throughout the whole night. Oh, wow. Yeah.
That's great. So, okay, John, I'm in pain. Okay, I come in. Where do I go? Do I start with you? Do I start with Debbie? What's the pathway to find out what my problem is and how to correct it?
Well, what a great question. So our ladies at the front will really filter those questions a lot of times. So one of the things we're going to look at is if it's post-surgical, or if it's if we consider it to be a weakness pattern, we'll usually start you with physical therapy, because they're going to spend a little bit more one-on-one time with you as far as, let's exercise you together. Let's make sure you're doing these things properly. If you're having something that's more, hey, I was planting flowers this weekend, I'm having this acute flare-up, they'll usually start on our side of the office as they come in. From there, we're going to bring you in. We're going to do a full assessment. We're going to get all your vitals, your blood pressure, your height, weight, your respirations, all of those kind of things, because all of those are super important. So we're going to get all of those taken care of. We're also going to do a brief orthopedic and neurological exam to kind of figure out what the big picture looks like. Is this really just a pulled muscle, or do we have something underlying that's just kind of manifesting as this back pain or leg pain, whatever it may be? Then from there, we're going to start to develop a treatment pattern or protocol for you. If we find that in the first couple sessions that we're not getting where we need to be, then we can do x-rays, we can send you for MRIs, we can do all those kind of things, or even communicate with your primary care doc.
Right.
So we do a lot of communication with our other medical or allopathic docs, which is one of the great parts of being in a small town.
Right.
We all know each other, we
Yes.
all serve together, and we're all looking for the one thing. We're looking for better outcomes for our patients.
Yes.
So it's not us against them. It's not this is the only way that works. We're going to look for what's best for Jim, what's going to make Jim the best version of Jim that he can be.
And that's what I want, and that I know that's what everybody that comes in to see you
Yes, sir.
wants as well. So that's great. So one of the things that when you first started offering this a few months ago, I think it was a few months ago, was some stretch therapy. I was really impressed with that, and I've tried to continue to do that on my own as well, but it's not quite the same. But tell us about that.
Yes, sir. So every day, every patient that comes in, we're like, hey, you've got to stretch more. You've got to move more. And whether you be 10 years old or you're 90 years old, people need to be in motion. Motion brings fluid to that area. Motion is going to increase circulation. It's going to decrease nociceptors, which are pain patterns. So we were trying to figure out what's the best opportunity to get folks to stretch more. And they have these little things called stretch labs and stretch zones and those kind of things. So Deb and I had gone over and visited a couple of these semi-local stretch clinics, and it just wasn't medical enough. It was more just kind of the cookie cutter type stretching stuff. So we were in a seminar in Nashville last year, and as we were kind of learning what we were there for, there was a group there with medical-based stretch protocols. So we went over and visited with them just a little bit and really picked their brain from a clinical standpoint, because a lot of these folks were just kind of gym owners who dabbled in this stuff, but we wanted to know what's the really nitty gritty and how do we really make this more of a medical-based stretch program. So we met up with a group out of Connecticut and brought their lead guy into our clinic and had him do a training session with all of our staff. So we have 11 certified stretch therapists out of our clinic now, which is fantastic. So as a patient comes in, we're going to send them, just like if they were coming in to see the chiropractor or the physical therapist, we're going to have a conversation with them on where they have been, what's given them a problem, what's their deficits. We're going to take some video of them moving, whether it be an overhead squat or bend down and touch your toes, those kind of things. And we're looking for irregularities. What's different between your right side versus your left side? Do you have chronic low back pain? Have you had shoulder surgery? All those kind of things come into account. And then we start a stretching protocol where it's one-on-one. So you have a stretch therapist who's a trained stretch therapist who will stretch you from earlobes to tiptoes.
You're right, he will.
So we'll start you on your back, and we talk about everything as a stoplight. We've got green means go, keep stretching.
Right.
Yellow means, hey, we're approaching that caution place. Let's kind of slow it down right here. And then red means, hey, that's too far. Let's stop. So we're in constant communication with our patient as they're on the table. Hey, is this too much? Does this feel good? And all of our stretch therapists kind of know where that turnoff part is. But we'll start at your feet and we'll work through your foot, your ankle, your calf, all the way up through that whole kinetic chain. And we're going to do stuff on your back. We're going to put you on your side to work on you and put you on your tummy to do some stuff also, and even in a seated posture. So knowing that, hey, I drive a desk all day, we know where your limitations may be when we start talking about, your hip flexors may be short, your low back muscles may be too long, those kind of things. Start to help us figure out what's the best protocol. And this has been a game changer for us. Of all the things we've brought in, this has taken off, and we've had more compliments on this than most everything else.
Really, that's
Yes,
fantastic. And it's important too, they really get you started, but it's really up to the individual to continue this on their own
That's
as well.
exactly right.
Once you leave there as well.
Yes, sir. So just to that point, Jim, we'll try to point out as we're going through the stretch therapy, hey, your right hamstring's a little bit weaker or tighter than your left hamstring. This is somewhere that we can do at home. Here's some opportunities or here's some ideas that you can do at home to help facilitate it.
Yes.
We'll talk about posture training. If you are driving a desk a lot throughout the day, what's the best way to sit? What's the best place to have your keyboard? So a lot of ergonomics will kind of come through this. And a lot of our stretch therapists or PTs or PTAs or PT techs. So a lot of them have a lot of upper level training already.
Right. And for those of us that have all our limbs, we have a right arm or left arm or right leg, left leg, but we don't necessarily realize that they are different, and each one has different motions and so on as well. So, and this is very helpful in identifying that too.
Absolutely. And then these guys will also, if it comes to a point where the stretch therapy patient needs higher acuity opportunities, that's where we can turn them over to the chiropractic team or the physical therapy team.
Okay. And
then we even have a step down, what we call NC reps, and that's probably be the next thing that we start to talk about, is personal training and group training, to where we have one-on-one training and we have what we call a semi-private training protocol. So we've got a patient who's 93 right now, and she wants to continue to be independent. So she came to our trainer. She started with physical therapy, kind of got her balance going again, but she didn't really want to stop because she wanted to maintain that independence. So we turned her over to our personal trainers, who are all certified personal trainers, and they continue to do things like teaching her how to get on the floor and how to get off the floor. How do you step over top of this rug? How do you bend down and pick up the towel that you dropped on the floor? So we're doing a lot of true life lessons just to make her stronger and more comfortable. But it also works on her balance training so she can stay independent.
Yes, and that's one of the things that I found. I read a book several years ago about balance and the strength, and it's not just you have balance, but you have to have the strength to have the balance. So you're working on that as well.
Absolutely, absolutely. And these guys, I mean, they do such a great job, and it's very dynamic. So we always talk about people read the latest Muscle and Fiction magazine, and they all of a sudden come out with the latest, greatest exercise pattern. Well, that may not be the best exercise pattern for Jim. Let's figure out what's best for Jim, and how do we get Jim to his end goal, which may be his independence. Hey, how do I not get to a nursing home, at 80 or 90 or 100 even, and I can still live independent and still drive? We talk about folks like Bud Roberts, who's 95, and if I had to pick up basketball game, I'd pick him first.
Exactly.
But he's just always done some kind of motion-based something. And so it's funny when you talk to folks like that and they ask you questions, I'm like, well, tell me what you're doing, man. I need to learn from you. Yeah. So we're really trying to take that into account. And we're, again, making everything individualized. So even when we talk about one-on-one personal training, it's going to be, what's your end goal? What are you really looking to do? Are you just looking to play as hard as you can with your grandbaby? Or are you looking to say, hey, I'm going to go hike the Grand Canyon in 6 months. I need to be better for that. So it all comes down from little guys all the way to big guys. And then we also have sports performance stuff. So we've got a lot of athletes who come in trying to get more powerful, more strength, more flexibility, more speed production. And we look at these guys from the same aspect. We're going to build you from bottom up. So a lot of folks come in and say, hey, I want to throw a harder fastball. Well, that's great, but it starts at your foot. So we've got to start to figure out, how do we get more power generated through your foot that translates through your arm so you're healthy when you start throwing this.
Right.
So instead of saying, hey, I'm going to throw 10 games, now I can throw a whole season and not blow out my shoulder.
You
got it. Yes, sir.
Now, you mentioned you have a 93-year-old. What's your youngest and what's your oldest there?
Yes, sir. So I saw a patient on my side today that was 7 days old.
7 days
old. Yep. So if you think about the whole birth process, the birth process is pretty traumatic.
Yes.
So this little patient ends up with torticollis, which is kind of tilted head and body just doesn't kind of do what it needs to, which slows down the nervous system just a little bit. So my job is to help with muscle restriction that they have going on with that, but also stimulate the nervous system to see if we can get it to fire differently. So not necessarily is it firing too much or too slow. How do we just normalize it a little
Yes,
bit better.
okay.
And then again, teaching the parents how to manage that even at home.
Yes.
So that's the big thing. The parents get the baby way longer than we do. So let's educate the parents.
So you're not only working on the patient, but you're also training the parent.
Absolutely, absolutely. And people say, oh my gosh, you do a 7-day-old baby. Well, we don't treat a 7-day-old baby like we treat, a 30-year-old
Right.
Professional football player.
Right, right.
So two different entities and very soft touch type stuff. And then our oldest patient right now is 98.
98.
And 98 and
Fantastic.
just the greatest people ever. And just, I always say if I could only do babies and only do old people, that's all I would do, because those are the two ends of the bookcases that love you all the time.
Love you all the time.
Yes, and they've got so much just so much spark about life, at those points. And so just it does your heart well to see those bookends.
Yes, to see those results. They get the results, but you get to see the results
That's
too. And
exactly
that's very gratifying
right.
for you.
Yes,
I know.
sir. And when you can keep that 98-year-old still being independent,
Right.
and still going out and going everywhere that they want to go, and they can walk out to the car and they're not having to be wheeled in a wheelchair, and they may be using a walker or a cane, but they're still walking,
Right.
man, and still cutting up and telling jokes, and their mind's still good. They're doing something right.
Right. Now, John, we've talked about the things that you offer people coming into you. You're not only just a provider in this community, and you don't just take from the community, you give back to this community. Tell us about you and your staff and what you folks do to give back to our community, because it's a lot. It's a lot.
Thank you. This community's been so good to us, Jim, and you know that. And we've often said, whatever you give to the community will give that back to you tenfold. I grew up in this community. This community just rallied around me growing up. Even when my kids came through, one of my sons ended up with sepsis, and the community just rallied around him and followed him to Wake Forest. It started out, of course, at that time it was Moorhead,
Right.
and these docs just rallied around him and said, "Hey, we need to send you somewhere else." So just from that, he's decided he's a family medicine doc. He's getting ready to start his residency,
Right.
and he chose family medicine because of that, because of how this community supported him. So for us, we don't really advertise or get out or anything like that outside of giving back to the community. So I've had the opportunity to be able to be on the hospital board for 14 years now, and got the opportunity I'm going to stay on there for as long as they'll have me,
Right.
just to help make a difference.
Yes.
And then I've been on the chamber board and the YMCA board and the Salvation Army board, and anywhere they can fit me in, I want to be part of it. And right now I serve on the Eden Rescue Squad board. My wife serves on the Eden Boys and Girls Club
Right.
board of directors. I serve at our church as a trustee there. The Rockingham Council for Bible Education, I serve as a board member there. We're the team docs for the high school, so
Yeah.
we try to get out to every football game, whether it be home or away. We still treat the Moorhead High School athletes who get hurt in season free in our office, because it was done for me.
Right,
And it was a
right.
great way to give back to the community there. Anytime we have the opportunity to go out and speak just like this, we're going to take that opportunity, because we feel like it's our duty to give back to the community that gives so much to us.
John, thank you for being here today. We appreciate this greatly. It's very informative for me and for our viewers. But I would ask you one last question real quick. Parting advice. What would you tell our community about health-wise? What would you recommend?
Health-wise, it's not always convenient. It's not always easy, but it's always going to pay off in the end. Eat right. Get your small amount of protein in. Get your fruit and veggies in. Don't overdo white refined sugars and flours. Drink water. Tea is not water. Coffee is not water. Drink your water. And get some exercise. If you can exercise 20 minutes a day, and you don't have to be Arnold Schwarzenegger or Lance Armstrong, you've just got to move more.
Yep.
Get out, move 20 minutes a day. You will live a lot longer.
Great. Great advice. Thank you, Dr. John Dabbs of Eden Chiropractic. Thank you.
Jim, thank you.